All right, it's 11 o'clock. Let's be mindful of everyone's time. Thank you all for joining us for what we hope is the first of a routine joint media availability between all of the healthcare organizations in Southwest Idaho and Eastern Oregon. We're glad to have you all with us today. We have St. Luke's, Saint Alphonsus, West Valley Medical Center, Saltzer Health, Primary Health, and Valor Health all here today, representatives from them. What we'd like to do is remind everyone, if you can please mute your microphones, particularly the journalists, and turn off your cameras for right now. We have a few speakers you can see on the list here who will get things started for us, but then we will get to some of your questions. So until then, if you can keep your microphones and your cameras off, that would be really helpful. The speakers today, we have Chris Roth, St. Luke's Health System President and CEO, Odette Villano, Saint Alphonsus Health System President and CEO, Dr. David Peterman, Primary Health Medical Group CEO, Dr. Jim Souza, St. Luke's Chief Medical Officer, Dr. Richard Augustus, West Valley Medical Center Chief Medical Officer, and then also here and available for your questions, Dr. Stephen Nimerson, St. Alphonsus Chief Clinical Officer, Dr. John Kaiser, Saltzer Health VP and Chief Medical Officer, Brad Turpin from Valor Health, he's the CEO there, and then Christine Newhoff, St. Luke's Vice President and Chief Legal Officer. Again, they are not speaking, but they are all here to answer some of your questions today. So with that, I just want to lay out the ground rules again. When we get to the question portion, make sure to raise your hand down at the bottom of your screen, and I will call on you as much as I can in order. And then once you hear your name, unmute yourself. You can turn your cameras on at that time and ask your question. Be sure to tell us who you are, where you're from, and who you would like to answer your question. And with that, let's get started this morning with St. Luke's President and CEO, Chris Roth. Good morning, Chris. Make sure to unmute yourselves before you speak as well.
Thanks, Anita. Appreciate it. Thanks for the introduction. First of all, to the members of the media, I want to thank you for taking time to participate and welcome you all. Also to my colleagues on the line, health systems, other providers, thank you. I'm very proud. I know we all are proud of the coordination and partnership we've collectively had over the really since the beginning of this pandemic. And one of the messages I want to share is that the provider community has been strong and united and coordinating and collaborating really since the very beginning. And I think we're a stronger community as a result. And I think our response, our collective response, it's showing in our collective response. Relative to the purpose today, as Anita mentioned, we want to be able to provide timely updates for members of the media and the community. All of us are getting questions on a regular basis from community members and media, and this is an attempt to try to bring that together, answer questions best that we can, and also provide experts to all of you to answer questions that you may have on behalf of the community. And we also recognize the important role that the media plays in sharing that message. I do want to mention that we welcome feedback after this session to the extent that they are valuable. As Anita mentioned, we are committed to providing timely and accurate information, again, to the best we are able to. And to the extent that we want to continue these on a more regular basis, we will certainly do that. Today's focus is really going to be around the kids, and particularly as all of us are thinking about school and going back to school. Some have already started, some are soon to start. We recognize that this is an incredibly stressful time for our community, for parents that are dealing with the unknown, virtual school, in-person school, school safety, the importance of getting a strong education, and how we do that in the midst of COVID. I want to recognize and applaud the various school districts around the state. They have a very challenging role, and it's been gratifying to see them go through the decision-making process that really puts safety as a priority, but also balances the need to get kids back in school. And that's what we all want. We want kids back in school, and we want them in school safely. I also want to recognize the providers and physicians in the community who have made themselves available to the various school boards as they've made their decisions, each independently based on the needs of their communities and what is in the best interest of those students and their parents. We're getting lots of questions around transmission rates related to the virus amongst children. And in some cases, there's still a belief that perhaps children are immune. So we'll speak to that a little bit. My physician colleagues will address that. Relative to what we're seeing in the community, early in the pandemic, we saw certainly an early spike, a lull in June, and then in July, we started seeing significant increases. I do have some good news to share. Thanks to the great efforts in the community, increased vigilance, adhering to the 3 W's, wearing a mask, watching the distance, and also washing hands. At St. Luke's, we've seen a approximately 50% reduction in our hospitalizations since mid-July. So the efforts are paying off. We're also seeing a 50% reduction as it relates to the number of the percentage of positive tests from COVID. So we're seeing some early encouraging signs, and lest we declare victory, with school going back in session and more people gathering and mixing, we've got to continue our vigilance going forward. But I want to recognize our community, our health districts who have made some bold decisions, mayors of cities who have led and at times been very challenging for them and others. We're all trying to make the best decisions that we can, but it is making an impact, and we're seeing that in the individuals that we serve and reduced hospitalization rates. Final note, we're entering a very dynamic phase with schools going back in session. As I mentioned earlier, we'll continue to monitor what we're seeing relative to hospitalizations, clinic visits, infection rates, and so forth. And I know we'll all do our best to adhere to the 3 W's that we have, and that's really our continued ask to the community is wear a mask, wash your hands, watch your distance, because it's making a difference. With that, I'm going to go ahead and turn it over to my colleague, Odette Bolano.
I'm off mute. Well, good afternoon or good morning, and thank you all for being here. I want to echo a lot of what Chris said. I think that these press conference will make sure that we are keeping you informed and you are helping to keep people in our communities informed. I would say that our focus for you is to stick with the science. And so hopefully we are giving objective information to you about what we're experiencing. I would echo what Chris said about what we're seeing in our hospital, but I would like to add a couple of things. We are seeing a plateauing of the number of cases, and both St. Luke's and St. Al's have put out dashboards that you can refer to on a daily basis so you can watch our numbers. But what I would say, even though we see that our numbers are plateauing, the number of patients that we have in critical care is a significantly higher number. And I would tell you that we have right now 19 in our ICU, which is a significant number. Now that starts pushing against the other critical care patients that we need to take care of that are not COVID. And 6 out of those 19s have birth dates of 1970 or greater. So 50-year-olds and much younger is what we're seeing in our ICUs. So as Chris noted, we're not over this journey and we need to continue to stay vigilant. Idaho's rate of positivity is 10%, and Dr. Bricks was on a call with the Ada County commissioners and noted that Idaho is on the watch list for the White House as far as where we are and still considered a hotspot. On the focus of children, my heart goes out to anybody who has school-aged children or college-age students, because I know how difficult to make decisions are, and hopefully our experts will give you some information that will help you in making the decisions that you need to for your children. And I agree, we all want our kids back in school. We don't want a generation that has lost time in their learning capabilities. But I would say a lot of controversy of whether or not, as Chris noted, kids are carriers or not. and at what age do they become carriers. But we can say that from the Idaho Department of Health stats, 9.1% of the affected kids, people with COVID are kids. And that follows along with the national statistics, which is 9.1. And I most recently read an article, and maybe our colleague physicians can talk about this, is that they are now starting to wonder whether or not kids are carriers of a much higher viral load. And so that is a concern, right? And I think, the evidence that the physicians have presented to the school districts about wearing a mask, social distancing, doing all those things, we can hopefully get our kids back to school safely. We are starting to see in the media several colleges with increased number of COVID cases. So we cannot take our foot off the gas pedal on the proactiveness of what we need to do. I also want to make sure that, I put a plug in for immunizations early on in the pandemic. The belief is that immunization rates dropped significantly, and the way that they were measuring that is because children were not making it into their wellness visits where they do get their immunizations. So as we begin to go into flu season, I put in a plug that, we're going to have to be vigilant about making sure people do get the flu vaccine as kids are going back to school, that, they're immunized. And if we look at the Southern Hemisphere, there's studies that have shown that their flu season is significantly lower than what they expected because they are practicing wearing masks, hand hygiene, and social distancing. So with that, I am going to turn it over to Dr. Peterman as he gets our panel of great physicians with detail on the science.
Thank you, Deb. And while I'm speaking, Anita, you can go ahead and pull up my slides. So I'm the chairperson of a group of local physician leaders, some who are on this call. And the intent of our group was to understand that school boards, health departments, and all the way up to our leaders are in very, very difficult situation. And I guess the best way to explain this is, for example, if a restaurant has hepatitis, you close the restaurant and no one questions that. If a school has an outbreak of whooping cough, we have clear guidelines as to how to approach that. With coronavirus, as relates to children and schools, we do not have clear guidelines. If you look at the CDC guidelines, they're, quote, guidelines in a sense. They're not rules. They're almost what I would call impressions. If you look at the Harvard Collaborative, which many people follow, they have another set of guidelines and metrics. And so this makes it very challenging. The second thing I would say, in many respects, it's unfair I believe, for us to, and I think our group agrees, to put schools and to a certain degree school boards in the position of having to decide about the health of our children without clarity of information. And to a certain degree, this is what we look to our leaders for. And without trying to get too political, when things are unclear and we don't have clear leadership, and then we default to schools for so many things, it makes it very, very challenging. So again, circling back, our intent was to try to speak directly to school boards, principals, and teachers to give them the best scientific information so they can then choose what's best for their particular locality. So what this slide, and I just wanted to sort of give you an update on data. This is data from Primary Health Medical Group. We've done about 40 to 50%, maybe closer to 40% of all the testing for coronavirus in Ada and Canyon County. The colored boxes you see, and this is year to date, from March to today or yesterday. The green box is the number of negative tests. The red box is the number of positive tests. up to this point. And if you go all the way back to March, the positivity rate is actually quite high. If you go over to that left white box, and then you see the dates, those are the number of tests done at Ada County on a daily basis. And what I would draw your attention to is you look at those percents at the bottom and at the dates, those percents are still high. They're 10, 12, 15%. If we could go to the next slide. Oh, oh, all right. Yeah, and then this is Ada County, and this is the positivity rate. And we could just pause on that a second. So there are many of the national entities and the World Health Organization that use the positivity rate of tests done as a criteria or metric in terms of sheltering at home and opening up businesses and going back to school. Most agree that you want a positivity rate less than 5% to completely open up your community and completely open up schools. If you'll notice, looking here at Ada County, the positivity rate is still high. Now, I caution you on the last bars because we don't have all the data in, but nevertheless, what you show is the trend is still very high. And despite the fact Chris and Odette shared with us that the admission rate to the hospitals has decreased, we're still seeing this high positivity rate, which is very concerning when you think of the possibility of children going back into schools and beginning to be around each other and unfortunately possibly lead to greater community spread. Next slide. So this is a quick Canyon County. Here, again, same thing. 7,600 negative tests, 1,400 positive tests, and a positivity rate of 16% going all the way back to March. Again, same thing that you see down at the bottom left when you look at the other box there. You see high percentage rates of positivities in terms of similar to Ada, but higher. And as you recall, Odette said to us that the CDC and the White House Task Force still looks at Ada and Canyon County as high-risk counties. Next slide. Again, this is the Canyon County, same positivity rate of the last few weeks. Those are the bars to the right. And what you see, the positivity rate still very high, most of them above 15%. That last bar, we don't have all the data in. Next bar, or next slide. So this slide, I think you all know I'm a pediatrician. This is the slide that's the most concerning to me. And let's focus more towards the left rather than the right. And if we look, the yellow bars, that's the positivity rate of tests since June 1st, following when the community was opened up. And the bars to the left are the gray ones are from the very beginning in March. And what it shows, particularly the yellow bars, if we look at that age 5 years to 12, which is the elementary school kids, the yellow is 10.2%. Remember what I said, your goal is to get under 5%. It's double. And then if we jump up to the teenage kids 12 to 18, positivity rate is 12.4%. Those are very concerning rates. And I will just comment a bit on what Odette and Chris stated. Yes, there is some data and some reports to suggest that the infectivity of children, the younger they are, is lower. But in a sense, whether it's lower or not, we have clear data here in Ada and Canyon County that those children that are tested, there's a very high positive rate. And I would just end my segment with a couple of comments here, which are, first of all, I think our physician group, I can safely say, speaking for all the physicians, yes, we agree, children need to be in school. However, we remain very concerned, and that concern stems from the positivity rate, which is still high for Ada and Canyon County. Second, data which shows the positivity rate is high for school-age children. Third, I can speak for myself, and I believe the rest of the group. We are very concerned that the schools have the resources to, frankly, safely open up schools. I think we have referenced in the past that it takes tremendous amount of work, just as hospitals and clinics, to structure things such that we can see patients safely. For the schools to have to do that will take a tremendous effort, and we hope they have the resources. Along with those resources, of course, they need everything that we need, which is hand sanitizer and wipes and those things. And then finally, I would add that my concerns for risks in terms of the children and getting infected, my concern is equal for the teachers. If we have teachers that begin to contract COVID, then of course that's going to have a cascading effect, which impacts classrooms. So I'm not sure who's speaking next after me. So I defer to Anita. And I'll, of course, answer any questions.
I can jump in, Anita. Thank you, Dr. Peterman, and thank you, Odette, and thank you, Chris. I was, for my comments, I want to bookend them. I'm going to start with a fact, and then I'd like to end with a recommendation, or I guess a wish. The fact is that the last 2 weeks of July, as pointed out by Dr. Peterman, we saw an 80% increase in pediatric cases of COVID, and this was before schools opened. Also agreeing with Dr. Peterman, we agree that it's critical that our kids get back in school. And I guess there's this sort of what I see as an either or kind of a false dichotomy that is promulgated, and we would like to suggest that there's an and. The either or false dichotomy is, well, either you can neglect safety and do in-person instruction, or you can elevate safety and do all online instruction. And respectfully, we think there's an and, as I'll discuss here in just a second. Over the last few weeks, I've had the chance, I know all my colleagues have too, to interact with a number of school boards, school districts, or individual schools. And I first of all want to applaud their approach. I see all of them doing their best to put science in the middle of their decision making. And then frankly, I want to applaud their courage, because they can't dodge a decision. They've got to make a decision, and they're making that decision oftentimes in the absence of higher level leadership providing them with a clear guidance. And it's this fact that's leading to sort of the different responses and plans that we're seeing. Having said that, I have personally reviewed a large number of plans and answered questions about the design of those plans. Largely, I've come away with the perception that for the most part, they're well conceived. And I've also come away with the impression that where I have concerns, people are listening and ready to make modifications to the plans based on those concerns. The key to success here, though, in achieving that and, is not how well the plan is developed, right? It's how flawlessly it is executed. And in that flawless execution of a plan, I cannot emphasize enough the need for consistency. So you can't have a plan that you give to your teachers and expect them to just implement it. At every level of school leadership, from the board to the administrators, to the teachers, to the students, and beyond to their parents, have to execute these elements of the plan consistently in order to achieve that flawless execution. And now I'll truncate my comments here and make more time for Q&A. I'm going to tee up Dr. Augustus in a second, but I do want to say that we know what will happen if we don't do what I just said. So, you look at our experience with this in Idaho so far. We dealt with a surge in the end of March and the beginning of April. And the governor issued his shelter-in-place order, which was like a cooling blanket on the situation. Everybody stayed home, people stopped moving. And after that occurred, some weeks later, we started seeing decreases in activity. As Dr. Peterman pointed out, when our community started opening up again, and all of those behaviors that were practiced during the shutdown were ignored, we predictably saw another surge in activity. And what we've seen in response is more robust efforts around the 3 Ws. We've seen certain municipalities actually enact new policies, and not surprisingly, we're starting to see that work. And you heard that from Chris and Odette. This is no time to back off when we're starting to win in this battle. This is the time when we press the advantage and we continue these practices. And that brings me back to school. And bookending my comments, the recommendation, or perhaps it's a wish, is that we really do commit to consistently and flawlessly executing these plans. And key to that, and you can look around at large universities that have tried to create bubbles, universities like Notre Dame, and the flaw in their plan has been the breaks in behavior. So behavior is going to drive this. Breaks in behavior have allowed the virus to grab a foothold and surge. So we got to stick to these 3 Ws, please. Dr. Augustus, I think I'm turning it to you.
Thanks, Jim and Dr. Peterman. I would echo what's been said, that what we really need to do is continue to press and try to keep this from surging again. But I think the reality is we're all getting tired, that wearing a mask every day is hard, that social distancing and staying away from our friends and family is hard. But we have to realize the extent of the outbreak that we have in our community. When you look nationally at the news, when things in Italy blew up and things in New York blew up, we were all shocked and scared by that. Now in Idaho, we're seeing those same kind of numbers. Canyon County is at 3,000 cases per 100,000. We are similar to these areas of the world that hit the news. We're not making the news because it's happening in so many places now. But we need to continue to think of things in that light, that this is still an active disease process. We're still seeing a lot of community transmission. We're not done with this yet. So if we can continue to do the things that we know will impact it, then hopefully we won't see that surge again that's predicted. When you look at the models now, it's saying maybe in December we see another big spike. We don't have a lot more capacity to deal with a bigger spike than the one we just went through. We did well, and that's great, but I hope that people don't take that as, hey, we're fine, we don't have to worry about this, because we do need to pay attention. And I agree with Jim, as we talked with our school leaders, they are thoughtful, they are concerned about these kids, and they are trying to do the best thing that they can. and their plans are well designed, if they can execute on them and follow them, I think we'll do okay. But the fear is that we all get complacent and we go away from these well-designed plans and don't follow them. So I hope that we all pay attention. So I'll yield it back to you, Anita, and for questions.
Yeah, let's go ahead and open it up for media questions. Again, go ahead and raise your hand. We'll call on you. Let us know who you are, where you're from, and who you would like to direct your question to. Do we have any questions from the members of the media that have joined us today? As we wait for them to unmute themselves, I'd be curious to have some of your reactions to some of the activity that's been happening at the state capitol in terms of the protests and the lack of masks and the lack of physical distancing. Can you just share a little bit of perspective seeing that, given some of the work that you and your teams have been doing on a daily basis?
Anita, this day, are you asking one of us as a physician to respond to that?
Yes, please.
Well, I'm appalled. There's no other way to explain it. I mean, what an example for children, regardless of how irresponsible it was, but to allow people to forcefully, essentially with violence, come into our Capitol, and then demand they're not going to wear masks or distance. And frankly, the best I can tell, nothing was done about it, and the legislature continued in session. Oh my goodness, here we're trying to open up schools. What are kids to think? Beyond how irresponsible that is. We have seen all across the United States where there is a gathering of 50 people, 30 people, or even as relates to here in Boise to the bars, the original contact was 25 people on a beer bus, and there were positives, and then that spread, frankly, all throughout our community. So I certainly defer to the other physicians on the call, but appalling. To me, it is unacceptable.
Thank you, Dr.
Nemerson, Chief Clinical Officer, Saint Alphonsus, and I would piggyback on that comment, but I think it also is telling to the challenges that the schools are facing. So a couple quick comments about that. One, which Dr. Souza and others have referenced, is having a perfectly executed plan is dependent upon holding one another accountable, and teachers holding students accountable, and teachers and principals holding each other accountable. Policing that is not something that schools are really geared to do. And so that represents a whole new set of challenges for those organizations, which as physicians who've been giving advice to the different school districts and board members, we're really at a loss to help them understand how many people they need to be able to patrol the halls, if you will, make sure that students keep separated, that they keep their masks covering their noses and mouths. So that's one type of category that has had very little discussion about how do we keep people accountable and ensure that the plan goes off flawlessly. The other two things that I would add to the 3 W's Chris referenced that are unique to schools are ventilation and disinfection. And what I mean by that is, in order to reduce COVID transmission, the best circumstance is to simply not come in contact with someone who has it. So the greater the distance, of course, the better. Being outdoors where the air will blow the virus away from you is even better. And then finally, when the virus deposits on surfaces or deposits on the uninfected individual, eradicating it is critically important. And while we've heard the stories from many of our school facilities, we've learned that classrooms, even when we space students out, they're pretty darn tight, that climate control systems in schools were never designed to be like hospitals, and many of the school buildings aren't even of sort of modern age. So circulating air through them is a problem. And then finally, housekeeping to disinfect surfaces between class changes. It's next to impossible when you've got a full load of students in a high school to get into all the classrooms and quickly scrub. So that's just some of the challenges that schools are facing in this complex situation of high community prevalence that's been already shared with us.
Thank you, Dr. Nemerson. Ariana has a question. Go ahead, Ariana,
Yes.
followed by Shira.
Hi, my name's Art Piper. I'm with CBS 2 News, and I was just kind of wondering, I was thinking of asking Dr. Souza, if I'm pronouncing your name right, let me know if I butchered that, just kind of how things are going with the air quality as well. And sometimes you may have, similar symptoms if you're, suffering from the smoke, and maybe people confuse it with COVID, if there's a way to kind of, filter that out, or if you've seen those kind of things arise. And I know it's a loaded question, but just if you've had experience with that.
No, it's a good question. I'm a pulmonologist too. So every year when it's fire season, I get these questions about smoke. And I'm just going to come back to good advice. When it's like this outside, you should not be exercising outside, period. Now, you should minimize the amount of time outside, but you should not be getting your heart rate up and generating large tidal breaths and exercising in this, because it is well known to actually take people who already have chronic lung disease and trigger it. And it's also well known to take people without pre-existing lung disease and cause it. It can actually cause an asthma-like condition, a single high-level exposure on a day like this when it's so polluted outside. So you shouldn't be doing that. And if you're not doing that, then you're probably not going to get a scratchy throat or a scratchy nose or coughing or shortness of breath. And therefore, you won't get confused about whether or not this might be COVID. Similarly, knowing that we're dealing with a very infectious pandemic virus right now, you shouldn't be hanging out with people that aren't part of your bubble without wearing a mask. And you should be adhering to the good practices described by all of us. And if you're not, and you get those symptoms, you should put COVID in the possible list of things you might have and be seen by a healthcare practitioner. If you're doing both of those things and you're exercising outdoors in weather like this, and you're not adhering to the good practices in the middle of this pandemic, then I agree, things will be confusing, and you may have symptoms that are hard to differentiate, and a practitioner can help sort that out.
Okay, sounds good. Thank you so much.
David,
Thank you. Go ahead,
Anita.
Shira. Go ahead.
Dr. Nemerson, Saint Alphonsus again. I just want to add a couple of really important points to what Dr. Souza's just said. One is that if you have a pre-existing condition or you exacerbate that condition and then you get COVID superimposed on that, the illness that you're going to experience with COVID is going to be that much worse. And in fact, there's some suggestions from studies to suggest that the combination is worse than either of the two individually, meaning that there is probably a multiplier effect that happens if you get COVID superimposed upon asthma or another lung disease. And then connecting that to something that Odette said in her introduction, which I think is really important to pull out here. We do not want during flu season to have patients get the flu and COVID. That can be deadly. And so the importance of influenza immunization come this fall cannot be overemphasized. And we really need to get the word out there now that patients, young and old, should be looking to get influenza vaccination come fall.
Thank you. We'll go ahead and move to Shira, and then followed by Shira will be Audrey Dutton. Thank you.
Hi, Shira from KTVB here. We were talking about the State House earlier and your reaction to that. This is kind of collectively for the hospitals, but during today's hearing at the State House, there was a representative who claimed that hospitals are inflating their COVID numbers to get more money. I'm just curious, what's your reaction to that? What's your response?
So this is Odette with St. Al's. I know that there has been a lot of chatter out there about this. I can tell you that I think some of the distortion may be that CMS came out with a modifier to define COVID-related admissions. And I can tell you that we have a very strict process in reviewing all our coding to ensure that it is reflective of what physicians are seeing and able to react to. The IHA and also the American Hospital Association came out with statements on the misconceptions, I would say, that are out there that we are making money on COVID diagnosis. I can tell you that across the country, and here at Saint Alphonsus, the patients that are coming in with COVID that end up in our ICU, we are not making money on those patients. We're actually losing money on those patients. So are there bad actors in a country of, with 6,100 hospitals? Maybe. But I can tell you that we are not seeing that. And in general, from an ethical perspective, I do not believe that we are, as a community of health systems, doing any of that. And it would be interesting to see any proof that has been shown. CMS and also the insurance companies audit us all the time. And so I have not heard anybody come back on any of our health systems to show that we are inflating or inappropriately coding cases.
And this is Chris Roth. I would add to that, and thanks, Odette, great explanation. Department of Health and Welfare on their blog put out a really good kind of statement, a factual statement relative to this issue. Unfortunately, many of us have spent a lot of our time addressing or trying to correct various conspiracy theories or frankly, blatant lies and misrepresentations that have been put out there. I echo everything that Odette has said, and to suggest that hospitals are inflating numbers is it's pretty disappointing.
Thank you.
Audrey Dutton, you have a question. Go ahead.
Hi. Yeah, I've been hearing from people who are worried about getting their flu shot, not because they don't believe in the shot, they want it, but they're worried about exposure from going into a pharmacy or a medical office, even with the precautions that are taken. Are any of you planning to offer drive-through flu shot clinics or anything that isn't kind of associated with an enclosed space?
I can answer that, Anita. First of all, let me just first begin by saying we are very, very fortunate to have the hospitals and leaders we have in Boise. I've got the most gray hair and worked here the longest. The idea that somehow the hospitals are inflating or changing information is just ludicrous. And thank goodness they've been here to get through this and to provide the excellent care. And that includes the administrators and the physicians that are on this call. As relates to vaccinations, again, as a pediatrician, all across the country, children have gotten behind on their immunizations. And all of the pediatricians and the family physicians in this community are encouraging parents to bring their children in to get their normal immunizations. As relates to influenza, again, I don't want to necessarily get into all the details of every clinic associated with the hospitals and primary health and Saltzer, but all of us have created systems in which we can see patients in a clean, safe manner. I can understand someone's concern about getting vaccinated necessarily in a pharmacy, although they also have precautions. But as relates specifically to primary health, we have created respiratory clinics and clean clinics, and we vaccinate in the clean clinics, and we are actually have initiated vaccinations by driving. But again, I don't want to just simply say that I guess the best way to put it is to say to the population, you can get an influenza vaccine, you can get it at a safe, clean clinic, and that exists throughout the Treasure Valley on all the institutions that are on this call. And I defer to the other physicians on to sort of reassure the public that they can get their influenza vaccine.
Yeah, this is John Kaiser. I'd like to jump in on that one if I could. So we understand the concern that patients have, and we are not going to run flu clinics like we used to in the past because of the proximity, but you can make adjustments just like we have throughout our clinics on how to provide a safe environment. With proper use of PPE, I think patients should be encouraged that going to their physician's office is one of the safest ways to get that protection, and it's extremely important for us to do that.
Brad, I'm not sure if you'd like to chime in on that one as well. Everyone, Brad Turpin from Valor Health is joining us this session as well and can answer questions.
Yeah, sure. Thanks, Nita. I would, we're a small facility, so we're not able to have separate buildings for clean and COVID. So we've actually separated our facility. We're seeing all of our respiratory related illnesses outside of the building. And for flu shots specifically, great question. And that's actually a thing that we are offering. We're encouraging vaccinations, and we will be doing it. If patients choose to not do it in the traditional way of during a wellness visit with their primary care provider, we'll be able to do it by drive-by in our main parking lot.
All right, we have a few more minutes here. Are there additional questions from Audrey, Shira, Ariana, or anyone else who's on the telephone?
Just one question I would have is just what is the main thing you really want to the public to know? Something that's just the most important, what you really want to hone in.
This is Jim Souza. I would say that don't look at our recent trends in numbers and conclude that we're winning. Look at the recent trends in numbers and conclude that it's working. And therefore, we need to continue the press. Because if we do that, and recognizing all the challenges, then we can continue this trend and continue to operate safely.
So I would add to that you need to understand that the statistics from the hospitals are lagging measures. We are a reflection of what happened in the community the past 2 to 3 weeks. And so the focus on, well, what are the numbers in the hospital tell you already, past the crisis or the crisis that we're in, and the proactiveness of wearing a mask, washing your hands, and watching your social distancing are critical in this situation.
This is David Peterman. I would just add one other thing. What we haven't talked about is if children begin to go, and as they are beginning to go back to school in person. And again, I agree with Dr. Souza and everything else has been said. It's not an either or choice, it's an and choice. There will be positive cases. There will be children, and there will be teachers that are positive. And it will be absolutely necessary that as parents and community members, that we respond to that in terms of identifying who's positive, supporting quarantining, and then getting the appropriate people tested. And frankly, being flexible enough to realize that plans will need to be changed based on what happens. So I would reiterate the positivity rate is still high. And evidence would say from around the world and around the country that when children go back to school, there will be an increased community spread. And we will need to respond to that and continue all the things that have been said here.
If I could, this is Brad Turpin again from Valor Health. I think that one thing that connects those of us who work in healthcare and educators is a calling to service, serving each other. And I think one of the main points that needs to be made here is just our service to each other and I think, you know, Dr. Souza called it behavior. I mean, we are responsible for our behavior as members of this community, and main point has to be that we do those things in service to each other.
Emerson at St. Al's, I think what's been said in the last minute has really been very poignant. And what I would also add is parents need to ask the schools directly, what are you going to do to protect my child? And what do I need to do to protect the other children in that school? Because to Dr. Peterman's point a moment ago, there are some number of children who are going to be infected with COVID, who are going to be without symptoms and walking into that school. And we are not going to catch those kids. Those kids are potentially infections to others who may get much more sick. And we've not talked today about how sick kids can become with this illness. I know that our partners at St. Luke's have hospitalized and treated in intensive care children who've had complex manifestations of this disease. So it's incumbent upon all of us as parents to ensure that we are not sending a sick child into school, that if they are not sick, but they are harboring that virus, that virus is secluded within that child and doesn't get spread to another. And then finally, we do everything in communication with our leaders in schools to ensure that that child is not going to come back home with that virus and give it to my 80-year-old grandmother.
Would anyone else like to weigh in on that before we wrap things up today? Okay, are there any additional questions?
Hi, Anita. Kira with KTVB here. Quick question, just along that note. You know, I know Dr. Souza mentioned that there was an 80% increase in pediatric cases before schools were opened. And then I know St. Luke's had that intensive case recently. Have you guys been seeing more cases of kids coming in with COVID symptoms, or has there been an increase in that?
We have been seeing more children in our testing sites. We have not seen more cases yet of the multi-system inflammatory syndrome in children. Just to give you guys, though, a ballpark number of how we're thinking about that, if you look at the population of children across Idaho's footprint, and you ask, and you just say, well, let's assume only 20% of them acquire this infection in the next year. And you know that the incidence of this severe manifestation, where part of the, by the way, part of the criteria for that diagnosis is you're sick enough to be hospitalized. And you know that that occurs at a rate of roughly 1 in 1,000. I mean, we're predicting that we will see about 70 more such children in the next 12 months. And that's kind of sobering because it's life-threatening.
Thank you.
All right, we'll leave it one more opportunity for questions before we go ahead and wrap this up. Any other questions? All right, well, I just appreciate all of your time today and for joining us and making time for this. We'll have a recording that's available if members of the media need that recording as well. And thank you to everyone who joined us and is watching on Facebook as well. We'll see you the next time we do this.
you.